The health department says all vaccines will be bought and distributed by national government, but some private companies say they are ready to fund their own vaccinations. To discuss if involving the private sector will help speed up the rollout, we're joined by Angelique Coetzee from the South African Medical Association. Angelique, very good morning to you. Why can't the private sector get involved at this stage? What's happening?
I'm so glad that you're asking me this question, Jane, because there's such a lot of confusion out there. So first of all, it's important to understand that the Johnson & Johnson vaccine is currently under a Study 3B open enrollment implementation. It means there's no placebos that's been used. What you get is the real deal. So that's the first thing. That are in the process of being registered and this, at SAHPRA. The second thing is Pfizer got registration yesterday, but it only got registration as to be used under a Section 21 emergency. So what we need to understand is that in South Africa currently, we do not have the same process that they have in other first world countries. So the Act, the Medicines and Related Substance Act, is currently undergoing an overhaul, and emergency authorization will then be included. So until that's not happened, we will have see vaccines coming in as Pfizer under a Section 21 emergency to enable that product to come in. So technically now, once Pfizer, as we have seen yesterday, has been approved under Section 21. That means that the private sector can start to procure the same vaccine. They cannot bring in other vaccines. Remember, we only have Johnson & Johnson and Pfizer. So once if they, and Pfizer at this stage is Section 21. So Discovery, for example, can now apply through emergency Section 21 to bring in Pfizer, but that's the only one that I can bring in currently.
Okay, yes, because I believe Discovery has been engaging directly with several of the key vaccine manufacturers. So, I mean, obviously, okay, so I realize that there's security protocols and safety protocols. Once we've got to that stage, I mean, what sort of timeline are we looking at here?
So the problem is, if you want to have full registration, it needs to be gazetted. That takes about 3 months to be gazetted, and thereafter it's full registration, and you don't have to go through the SAHPRA process there. But up until that time, as it is now currently in the Section 21 emergency, until that changes, they can apply, but only for Pfizer.
And what about producing their own vaccine? I mean, I know that we haven't got there yet, but if a South African private company were able to do that, what happens then?
Well, I think they can do that if they are able to, but currently we don't have the technology. We had the technology in the early 90s, and then due to a lot of other problems, they just stopped it. I know there wasn't money issue about it, so all that was closed. And so you now need to start all over again. It's a highly intensive process. It's a costly process. But I think South Africa had been there once, and we supplied to the rest of Africa. There's no reason why we can't do it again. We've got all the technology in our country. We've got the people who's qualified. And yeah, but that will take more or less more than a year. So in the meantime, we need to bring vaccines in, and as I've said, once if it's fully registered, the process is very simple. Okay. But for now...
Oh, sorry. Let me just ask you this. We're hearing that the world is running out of the correct needles, the appropriate needles, which help by its efficacy by about 20%. How much of a problem is that? And when we look at the slow rollout continuing in South Africa and know that new variants are out there, what are we projecting here?
Well, you are so right. The needles is extremely important. It needs to be the right length. If it's not, and it doesn't go into your muscle, deep into the muscle, you will have a lot of pain, side effects, around the area of vaccination. So yes, we need to get that. It is going to be a problem. So for South Africa, need to be aware of this, and I'm quite sure they are, and they should have made sure from the National Department of Health side that we have already imported enough needles, whether you are going to use the Pfizer one, whether you're going to use the Johnson & Johnson. So that is, we call it planning. So we hope that planning has already happened in the background. The next thing is, for the vaccines to come into the country once, if it's full registration, it should not be a problem then if the private sector brings it in, negotiate in the background, maybe use their contacts to also bring in the correct needles to do this. But it's a problem. And then the rollout, yes, you're right, it's very slow, but remember, we only have the Johnson & Johnson vaccine, and as I have said, under the phase 3B coming into the country. So to try to help, because to help to vaccinate the healthcare workers, if they haven't done it in that manner, we would still have to wait till around about April before we could have brought in any vaccines into the country. So for that, yes, it's slow. It's 500,000 vaccines coming in, but it also is a learning process, and it's helping us a lot to gather the data, so that once if we start with phase 2B, which are 2, where the public is going to come in, I really think we're going to see a lot of challenges, but it would be less because of the lessons that we learned.
Let's leave it there. Angelique Coetzee, always good to talk to you. Thank you.